Welcome back to another Clarity Education Systems live session. I'm Dr. John Rossi, and I'm excited you're here, ready to keep pushing forward on your journey towards becoming a certified PMHNP. Every week, we dive deep into high-yield practice questions, evidence-based rationales, and real-world scenarios designed to sharpen your clinical thinking and examine strategies. This is where we study, and this is where we meet strategy. Whether you're here to master tough concepts, strengthen your test-taking skills, or simply stay on track, you're in the right place. So grab your notes, clear your mind, and let's get to work. You're on one step closer to crushing the exam. All right, let's go ahead and dive right in. First question. A researcher is conducting a study to examine the effectiveness of new cognitive behavioral therapy, or CBT, in reducing anxiety symptoms in adults. The researcher collects pre- and post-treatment anxiety scores from a sample of 150 participants. The data are normally distributed, and the researcher wants to determine if the therapy led to a statistically significant reduction in anxiety symptoms. Which of the following statistical tests is most appropriate for this analysis and why? Answer A, independent samples t-test, because it compares two unrelated groups before and after treatment. B, a chi-squared test of independence, because it assesses the relationship between categorical variables. C, paired samples t-test, because it compares two related measurements from the same participants. Or D, one-way ANOVA, because it evaluates differences among more than two groups over time. So think about this carefully. What's the best statistical method when comparing the same group of people before and after treatment? Go ahead and take a moment. You can pause the podcast or the video and give it a try. All right, if you chose C, paired samples t-test, you're absolutely right. Let's break down why this is the most correct answer. So a paired samples t-test is designed to compare two related measurements, like anxiety scores, taken from the same group of people before and after an intervention. So this test assesses whether the average difference between the two sets of scores is statistically significant in the study. So in this case, the researcher is measuring anxiety levels in the same participants before and after a CBT program. Because the data are normally distributed, the paired samples t-test is the most appropriate choice to analyze whether that CBT effectively reduced the anxiety. Now let's discuss why the other options don't quite fit. So option A, this test compares the means between two separate unrelated groups, but our study measures the same group before and after therapy, so this doesn't apply. Option B, chi-squared tests are great for analyzing relationships between categorical variables like gender and diagnosis, but they cannot be used to look at the continuous data like an anxiety score. Option D, ANOVA. Now, this is used to compare the means across three or more independent groups. Since we only have two related measures here, pre- and post-treatment, ANOVA is not necessary. So understanding statistical methods like paired samples t-test, it's going to be crucial for evaluating research and applying evidence-based treatments. It shows how we determine if therapies truly work. All right, great job. Let's keep the momentum going. On to our next question. So let's shift the focus to public health. This is a vital area for practice for PMHNPs. Understanding national health objectives helps us better address the growing mental health challenges in our communities. So the question, the Healthy People 2030 Initiative outlines national objectives to improve the health and well-being of Americans. Despite ongoing public health efforts, one critical mental health objective has shown worsening trends in recent years. Which of the following objectives is currently moving in the wrong direction? Answer A, increase access to mental health services for adults with serious mental illness. Answer B, reduce the prevalence of major depressive episodes among adults. C, decrease opioid abuse and overdose nationwide. Or D, reduce suicide attempts by adolescents. So take a moment to think about the current public health trends. Which of these objectives has the unfortunate truth of being a worsening situation in recent years? Okay, if you chose D, reduce suicide attempts by adolescents, you're correct. So let's talk about why. This is a concerning topic. So adolescent mental health has become a growing crisis nationwide. Despite national efforts, the suicide attempts among adolescents has been increasing. So factors that contribute to this trend include rising rates of anxiety, depression, social isolation, bullying, and the influence of social media. The Healthy People 2030 initiative aims to reverse this, but recent data shows we're moving in the wrong direction. A report by the CDC highlights that suicide is now the second leading cause of death among individuals aged 10 to 24. Limited access to mental health resources and persistent stigma surrounding the mental health illness make the situation worse and more urgent. So let's look at why the other options are incorrect, but yet still concerning. So option A, policies like expanded Medicaid coverage and telehealth services have actually improved access to care for adults with serious mental illness. While changes remain and challenges remain in all of this, progress is being made and there is increasing mental health service availability. Option B, depression is still a significant issue, but public health campaigns and greater awareness have helped stabilize adult depression rates. Access to treatments like therapy and medication have also improved. Option C, now, although the opioid crisis remains severe, targeted interventions such as wider distribution of naloxone and expanded treatment programs, these have led to some improvements in certain regions. So the crisis isn't over, but steps are being taken to right the wrongs and go in the right direction. So this is a powerful reminder of why mental health advocacy is critical. As future PMHNPs, you have the opportunity to intervene early, reduce stigma, and advocate for better access to mental health care for youth. All right, moving on to the next question. Let's talk about one of the most critical aspects of psychiatric care, assessing and managing suicide risk in patients with bipolar disorder. This is an area where PMHNPs can make profound differences. So the question is, a 27-year-old female patient with a history of bipolar 1 disorder presents for a routine psychiatric evaluation. She reports feeling increasingly hopeless, with worsening mood swings, irritability, and disrupted sleep. Although she denies current suicidal thoughts, she admits to feeling overwhelmed and isolated. The PMHNP understands that individuals with bipolar disorder are at significantly higher risk for suicide. During which phase of bipolar disorder is the patient most at risk for suicide? Answers include A, during periods of euthymia, when mood symptoms are stable. B, during acute manic episodes characterized by elevated mood and impulsivity. C, during depressive or mixed episodes involving mood instability and depressive symptoms. Or D, during hypomanic episodes when energy and productivity increase. Okay, so think carefully about the phases of bipolar disorder. Which phase carries the highest risk for suicide? Take a second. All right, so if you selected C, during depressive or mixed episodes involving mood instability and depressive symptoms, you're absolutely right. All right, let's take a closer look at why this is the most dangerous phase. So patients with bipolar 1 disorder are 10 to 30 times more likely to die by suicide than in general populations. The greatest risk occurs during depressive and mixed episodes. So during these phases, patients experience intense mood instability, deep hopelessness, and overwhelming emotional pain. Mixed episodes, in particular, combine depressive symptoms with anxiety, agitation, and impulsivity. This creates a perfect storm for suicidal behavior. So research from an article in the American Journal of Psychiatry consistently shows that the combination of severe depression and heightened energy or agitation dramatically increases that likelihood of suicide attempts. Recognizing this risk is going to be super important for timely interventions. So why are the others wrong? And option A, during that period of euthymia is going to refer to the mood stability between episodes. Patients are generally more balanced and are at lower risk for suicide during these times. But it is important that we remain vigilant. Option B, So mania is marked by impulsivity and risk-taking behaviors. But the risk for suicide is actually lower than during depressive or mixed states. So manic episodes tend to involve grandiosity and reduced insight, which can buffer against the suicidal thoughts. Option D, hypomania. So hypomania involves elevated mood and increased energy, but it is typically less severe than full-blown mania. While patients might engage in riskier behavior, the profound despair associated with suicide is usually absent. So as PMHNPs, it's going to be super important to recognize these high-risk phases. Suicide prevention begins with understanding when patients are most vulnerable and then providing the right support at the right time. So your ability to identify and intervene during these critical moments saves lives. All right, let's keep moving forward on to the next question. So let's explore how genetics factors into sleep disorders. This is a topic that often comes up in psychiatric practice. We need to understand the science behind conditions like insomnia in order to help us provide accurate and effective care. So the question is, a 40-year-old male presents to the clinic with complaints of chronic insomnia, stating that several family members also struggle with sleep disturbances. He believes his insomnia is inherited and requests genetic testing for sleep disorders. Which of the following is the most appropriate response by the PMHNP regarding the role of genetics in the development of insomnia? Option A. While genetics may influence sleep patterns, they have not been substantiated as direct causes of insomnia. B. Genetic testing can identify specific mutations responsible for chronic insomnia in most patients. C. Insomnia is primarily a genetic disorder and requires pharmacogenetic testing before effective treatment. D. Genetic predisposition is the sole determinant of insomnia, making behavioral interventions less effective. All right, so think about how genetics and environment interact in mental health conditions. Which response best reflects what we currently understand and know about insomnia? Okay, if you selected A, while genetics may influence sleep patterns, they have not been substantiated as a direct cause of insomnia, you're right. Let's break it down. So research has shown that genetics can influence sleep patterns and a person's susceptibility to sleep disturbances. Certain genetics and certain genes related to the circadian rhythm regulation, like the PER3 gene, these have been linked to sleep disorders. However, insomnia is multifactorial. So psychological stress, behavioral habits, medical conditions, and environmental factors do play a significant role. So the Academy of Sleep Medicine has studied this incident and this thought of genetics in insomnia, and we've discovered that there are just many significant roles. So Sleep Medicine Review has emphasized that a single gene causes insomnia. So while family history can increase, there is no single gene that results in order to genetically explain the situation. So instead of genetic testing, the most effective treatment for chronic insomnia is often cognitive behavioral therapy for insomnia, or CBTI, which focuses on changing unhelpful sleep habits and thought patterns. So let's review again why the other options are not true. So currently, there is no genetic test that can reliably identify specific mutations that cause insomnia. While research is ongoing, genetic testing is not currently a part of the standard clinical practice for sleep disorders. Option C, so insomnia isn't primarily genetic. Pharmacogenetic testing can help guide medication choices in some psychiatric conditions, but it isn't helpful for managing insomnia. So behavioral interventions, like we talked about CBTI, remain the gold standard. Option D, so genetics may play a role, but insomnia is never solely. Environmental stress, mental health conditions like anxiety or depression, and poor sleep hygiene are significant contributors. So behavioral treatments are highly effective regardless of genetic predisposition. So it's important to guide patients toward evidence-based treatments, understanding the balance between genetic predisposition and environmental factors. And this allows us to offer realistic and effective care. All right, let's move on to the next question. So let's explore how technology and nursing practice come together. In today's healthcare setting, understanding how to evaluate and improve clinical tools is crucial for patient safety and staff efficiency. So the question is, a hospital is evaluating the implementation of new bedside monitoring equipment designed to improve patient safety and also clinical efficacy and efficiency. However, nursing staff have repeated and reported difficulty navigating the system's interface, resulting in delays in patient care. So to address these concerns, the nursing informatics team decides to apply the usability theory to assess and improve the user-friendliness of the equipment. Which of the following strategies best reflects the application of usability theory in this scenario? Option A, conducting usability testing with nursing staff to identify design flaws and optimize interface for ease of use. B, increase mandatory training hours for nursing staff to ensure full proficiency with the equipment. C, developing a standardized user manual to guide staff in operating the new equipment. Or D, limiting access to new equipment to only senior nursing staff until full system proficiency is achieved. Okay, so think about what usability theory focuses on. What does it actually mean? Making systems intuitive and user-friendly. So which strategy actually solves the problem? All right, if you chose A, conducting usability testing with nursing staff to identify design flaws and optimize the interface for ease of use, you're right. Let's break it down. So the usability theory is all about the effectively implementing and the efficiency of implementing users so that they can interact with the system most appropriately. The best way to improve a system's usability is to involve the people who use it, nurses in this case. So by conducting usability testing, the hospital can directly observe where the staff are struggling and what's going on with the equipment or the need to gather feedback in order to pinpoint specific flaws. So this collaborative approach allows the developer to adjust the interface to better meet the user needs. So according to the research in the Journal of Nursing Administration, usability testing is a critical step in ensuring that healthcare technologies are safe, effective, and user-friendly. So let's take a look at those other options. B, more training might help staff get used to the equipment, but it does not solve poor design. So if a system isn't intuitive, no amount of training is going to fix it. Option C, user manuals are great for quick reference, but they don't address the core usability problems. So nurses need systems that are easy to use, not just instructions on how to work around confusing designs. Option D, restricting access might reduce errors temporarily, but it prevents comprehensive feedback from all staff. Plus, it doesn't improve usability for the entire nursing team. So technology should work for clinicians, not against them. Involving end users in system design and improvement ensures that healthcare tools actually enhance patient care. All right. So that wraps up our questions for tonight. Great work, staying focused and engaged. And at this point in our live sessions, each Wednesday night, we open the floor to you. This is your time to discuss any questions that you have, whether it's challenges you're facing in your semester, concepts to the Clarity Review Program, topics for your personal study materials, practice questions you've been working through, or anything else that's on your mind. We are here to support you every step of the way. So for currently enrolled students, this open forum is available through the live link on the PMHNP student portal. All you need to do is click in it and join the conversation. You'll have that if you have access to the student portal. But before we wrap up today, I want to leave you with a couple powerful reminders. All right, so Frank Sinatra once said, "The best revenge is massive success." We've all faced doubt, setbacks, and maybe even people who told us we wouldn't make it. But the most powerful response isn't to argue or defend yourself. It's to rise above it and win. Every late-night study session, every challenge you overcome is a building block for your future. Let your success speak louder than any criticism. Stay focused on your goals and let your achievements tell your story. So if you've failed this exam once before, that's okay. Get revenge on that test. Let your massive success of passing it the next time govern all. All right, and finally, Sir Winston Churchill gave this timeless advice. If you're going through hell, keep going. This journey isn't easy. You hit walls, you feel overwhelmed, but stopping won't make it any easier. If you keep pushing forward, one step at a time, one climb at a time, you will come out stronger on the other side. Remember, tough times don't last, but tough people do. And you've already proven how tough you are by making it this far. You're capable of more than you realize. Keep your head up, stay focused, and keep moving forward. I'll see you next Wednesday at 1900 hours Mountain Standard Time or 7 o'clock. Until then, stay strong, stay driven, and don't stop until you're done. Bye-bye.